Good afternoon, everyone. So I really want to acknowledge Carrie's work on this presentation and all her leadership on this file. We've worked together and we've had the pleasure of working with Dr. Ware and Dr. Belneves on this issue, and really pleased to be invited along our physicians and pharmacist colleagues to present the implication for nursing. So I work nationally in, the other way, okay. Maybe, oh, there, it works. Go back, okay. CNA, for those of you who don't know who we are, is the national and global professional voice for nurses in Canada. And we've heard this morning there are 9% of the audience today who are nurses. So I've met a couple of nurse practitioners. So it's really great to have nurses involved in those conferences and to learn more about this issue. And we have been working tremendously into this issue in advancing, of course, advocating for policies and the profession. And our main goal is to remain in a not-profit health system and publicly funded system. So I will go over the 30 minutes over a couple of issues and our approach into both medical and non-medical cannabis, and describe implications for registered nurses and nurse practitioners in Canada, describe areas for opportunities moving forward. So CNA has been providing national leadership in both regimes, and we've worked in both areas, both at the federal government consultation level, and really emphasize the public health approach and harm reduction approach, similar to what Dr. Blackmer presented earlier. What we have is provided really advice on the two streams, and first of all, we were involved in the medical stream, recognizing that the use of medical cannabis is used by several patients, and we're going to learn today about special populations and situations as well as low-risk guidelines. And it's not any different for nurses. We are following through on the new evidence emerging in the field. We know that medical cannabis is used to treat particular conditions and symptoms, that there is evolving research, and we've learned recently more research around the link with opioids, and this is an area of promise, and we continue as an association to advocate for research funding for both areas of medical and non-medical cannabis. We have been vocal recently, and it was mentioned earlier today around the excise duty framework for cannabis products, recommending that the government do not tax the medical products, and for the same reasons that were described earlier today. Now I'm going to just speak about the nurse's role, and we've heard earlier about access to cannabis for medical purpose regulations that were revised recently, and we have now nurse practitioners are authorized under these regulations. And what particular issue and disparities around this is that there's only one jurisdiction that allows nurse practitioner to provide medical cannabis in Ontario. And as was described earlier with physicians, regulations is privy of provincial and territorial jurisdiction, and the authority has to be enabled at the provincial or territorial level. Under administration for the role of the nurse, one of the issue and challenge around the this issue is the administration is understood under the exception of the Controlled Drugs and Substance Act. There's so many areas where these things are brought up, and there is a provision around hospital employees, and that will affect nurses, where nurses can assist patients with medical cannabis, but beyond those settings, there are issues where it's not as clear, and there are diverse opinions, and our colleagues from the Canadian Nurses Protective Society are really prudent in advising nurses not to provide assistance with patients outside of hospitals. So this is creating an environment where we have been more vocal and attempting to standardize and influence the revisions of regulations. And we've learned that as some jurisdictions are providing different information to nurses. In Saskatchewan, for example, they are highlighting that the patient receiving publicly funded health services can have assistance from a nurse for medical cannabis. And in Nova Scotia, it's a different standard. And this is creating a lot of ambiguity for professionals throughout those jurisdictions, especially for nurses who are working in more than one jurisdiction. Now, I will speak more about the legalization of non-medical cannabis and our work and implication for nursing. So we are using a harm reduction perspective, and we've been vocal related to how we can use this approach when we're thinking about legalization, and having a code of ethics as nurses, and having a non-judgmental perspective when individuals are using cannabis, and being there to support them. So under non-medical cannabis, we've had been vocal around the need for education and for all healthcare providers, not only nurses, and also the need for nurses to provide information to patients or families that come forward with questions around this product. A lot of information on the news around cannabis, and as nurses, as the frontline providers, we get a lot of questions, and this is something that we hear almost every day, that there are issues and different ways of using the product, especially for situations where there's no other products that's been used or really working. We have been working as well in developing tools and more information based on evidence, and we have published 2 resources that's available for all nurses around harm reduction. And after that, we developed a document on non-medical cannabis use, using all the evidence that we have. And these are used by nurses, and there's good feedback on how it's useful for their practice. You see in the photo, this is Carrie, who should be here today, and Dr. Belneve. We've been very vocal on the Hill, and participated in the consultation, and have delivered webinars, again, offering more information on this topic. And we're going to continue to be very active on this issue. We've, as part of our work, we'd like to know more about the public impression on this issue, and knowing how the public feels the nurses are somehow important to be involved as part of this discussion. And we've learned through the NANOS research that we did last year with the public, is that Canadians rate themselves fairly knowledgeable about the effect of cannabis. At the time, it was marijuana that was well known by the public. And 9 out of 10 Canadians support or somehow support nurses educating them on the risk of non-medical cannabis use. So that created us additional information on the importance of having really nurses well prepared for the changes. We also did a survey with nurses and opened the survey, left the survey open for 2 months. We had 1,000 responses, and we assessed how nurses felt the knowledge and resource needed, and also their perception on the bill. And as you can see with this slide, there are definitely some areas that nurses feel that they have a need for more additional information and knowledge, and these are some of the findings. We also learned that nurses felt they needed, in addition to medical and non-medical, more information on reducing harm and addressing stigma and bias. That was a new area that we learned throughout this survey. So what are some of the opportunities? We recently hosted, with some funding received by Health Canada, a meeting last week, a think tank, and that was the first time that we were hosting such a meeting with experts from across Canada. And we learned that there's so much more we can do for nurses, and we are going to continue this work. We also want to continue advocating for the inclusion of nurse practitioners all throughout Canada as an authorized, not prescriber, as being authorized to provide medical cannabis, and advocate for clarity on the RN administration outside of hospital settings with the regulations. And we're going to continue to advocate on taxation and continue to develop more knowledge around this issue and provide support for our members. So I went through it fairly quickly, but I'm open to any questions that you may have. Thank you for inviting us.